my topic is OPD signifying self in improving practice. So people know who is the best, which is the best brand, they know which is the best facility. And how come your name is not there? So what actually are the barriers in self-promotion? Do you want to be really modest or not to call about yourself for any big achievement? So let us think of that what could be the barriers and how we can overcome them. So when you want to signify yourself, what do you want to signify? Your knowledge, expertise, modesty, concerns for the care, administration, ethical approach, humanity, absence of negative qualities, or your rational earning. All of these you want to signify. All of these you want to directly or indirectly want to convey to the patient that how much I have a knowledge, how much is my expertise and everything. So you are supposed to promote yourself because this is something which you want to discuss in such a webinar. It is not in the curriculum. It is not, you are not being trained for that. And if you are really good, it's a waste of your skill and knowledge because you are not promoted. And ultimately, those patients who need your expertise and knowledge, they are lack of it. So it's a less selling for the patient. So one must promote what they have the best. So you can promote what? You can promote only what you have. Including God has to say to the saint that please visit my website for the facilities in the heaven. So you cannot promote something which you do not have. So that is very important to understand what do you have to promote. So let us see that there are multiple factors by which you can have a very satisfactory or a roaring practice or some sort of whatever you want, you are happy with the practice. So there are multiple points on which anybody can be successful. So let us see, like you have a best of the qualifications or a skill or experience, or you have a legacy, you have a heritage, you have a brand, you have a goodwill. So you have that point. Not that all the points are with everybody, but few of them will make you successful. You have a good humanity, ethics, honesty. You have an art of convincing, communication. So that only it will work. You may not have a good qualification, you may not have a good legacy, but the art of convincing may work it up. Your location, you are having a prime locations where maximum patients they are through. So you'll be able to go through, or you have a group. You have a facility which is so fantastic compared to other hospitals, or you have a best technology with updated all everything. So go on promoting that, or you are a master of the equipment. You know that particular arthroscope or whatever the new gadgets, or the computer guided any navigation or whatever. So you have to promote that. Very important thing is sometimes surgeon is simply popular because he's every time available. He's so punctual. He's always attends. So pick up that what you have. You have to have a good receptivity or PROship. If that is good, that also you have to go on promoting that so and so will take care of it. And if you are in a team where there is a polytrauma, you can go on talking about it because we have a team. Something better can be done, or you can be given a good credit. And lastly, very important, you have to create an image that you have a love for mankind. You are a charity. People often say that ultimately let us ask him before we go for surgery to any other surgeon. If he says surgery is to be done, we will go for it. He may not come to you, but you are having such a good love for mankind and charity. So any of this, 2 or 3 or 5 or 6 factors is going to give you a successful practice. So what do you want to promote? Think of not only of these factors, but think of and develop what people like about you. Do not go on insisting what you like about, because what you like about people may not like. So you have to find out what people are praising about you and only promote those things, and that will click a lot. So before now we go with self promotions and advertisement, please see this 6.1.1 clause for the MCI. And that says let us read word by word. Soliciting of patients directly or indirectly by a physician, by a group of physicians, or by institutions or organization is unethical. That is number one. Although we need to have a movement to fight for the freedom, ultimately some day will come where we have to advertise our whatever is the specialty. The second very important point with ethical advertisement: a physician shall not give therapeutic article in any form or manner of advertising through any mode, or shall he boast of cases, operations, cures, or remedies, or permit the publication of report thereof through any mode. So you have to be smartly avoiding these potential litigations. So you have to be very careful that you do not go so much high so that it will be in the eye of all other administrators. Now, very important thing is that you want to say something like, guarantee and other things. So I, in my file, I write down like medicine is not an exact science. There is an unknown role of nature. I simply assure you my best efforts. And I also talk to the patient that nature surely would support my best skills for your complete recovery. But what actually I do is a modest way. I am not boasting, I am not showing off. But what I actually do is I say I guarantee. But the word I guarantee is so much, arrogant. So as I simply assure you, or say I am the best in the town. I cannot say like that because you're again arrogant. So I say my best skill will be supported by the nature. So these are the tricks by which you can say that I am the best. So once you have something which you think you are going to promote, take up this as a product. So you have to plan that, you have to prepare for that, and you have to propagate. So you know which are the best quality which are going to be praised by the whole lot of society. So there you have to have this. So where should be your presence of your product? That should be in all your stationaries, all your brochures, display boards, internet presence, and also whatever you are going to give as a flyer in a periodic in social media. All these things is very important, and all the time you have to see that you remain updated. If the phone number is older one or the email is older one, you need to check it that everything is updated with that information. So when you offer something to the patient, it is always good that you remain honest, sincere, ethical, methodical, systematic, and as per your capability. You do not talk so much if you are not capable of doing that, because you are doing that randomly. All the time be optimistic and smartly say harmless, incomplete truth. So you have to be so smart in telling the complication at the same time, not telling everything that can be so scary to the patient. Now, counseling and communication is very important. So you call all the relatives. You do not go on repeating when one relative comes into the cabin. You tell them that all of you should come, and you have to greet all of them, because it is now the treatment of the relatives or visitors rather than the patients. So you be careful whether you talk to everybody and have a clear dialogue. Do not have a confusion. And most of the speakers have said very correctly, you should go with the least alternatives. So much that you be so specific that I want to do like this, it is best for you. There are chances that he may not end up with you, he may go somewhere else, but this is the practice which is 80 to 90% is going to give you success. Then use apt and smart phraseology. Not use something which makes a jokes only. You have to be very careful, and all the time leave finances with others. Have a counselor, have a somebody. Do not talk much about money directly with the patient as far as it is possible. So counseling and communicating, when you do that, you know that you want to get involved, you want to self-promote yourself for empathy. So you point out something on X-ray, point out something on CT or MRI. Do not just sit idle. Use plastic models a lot, show some results on Google, and talk about some satisfied patient and say every time that he was so good, thank God. Go on thanking God multiple times. so that it appears that you are so much open. And whenever possible, have a 2 slides PDFs. So you quickly want to show something, so have a 2 slides presentation of all the cases which you have done the best, and ask them to be part of treatment. Now this is very important in counseling. Tell them we together can only get the best results. So say that it is only 50% on my side, and I always say that it is only 25% on my side, and rest of half is with the God and with yourself. So I'm not able to do everything together. Very important point in marketing or self-promotion is a care of key opinion leaders. You need to go for free of charge work. You need to go on having a smart reminders that what has happened to that, and you have to respect the referring person. Every time he may be talati, he may be sarpanch, he may be the elder person in that village, always talk about him and say that give my regards or say hello to your whosoever has referred, and always help colleagues in a big way. When colleague is asking your help, that is a key point to promote yourself. Maybe you are sacrificing your practice, you may be sacrificing your time, but see that you help wholeheartedly to your colleagues whenever they are in need. Now this is very tricky, the estimate or bill, and most strongly presented element in our case. So it's a major role in popularity, because even if you take 5 lakh rupee and patient is fine, he would say no, he is a fine doctor. But if you take only 1,000 rupee and the result is not good, it's going to give you bad name. So bad name is because of the result, but at the same time you have to see that you do not unnecessarily charge very high. So organize this type of task with the counselor or the other person who talks about the bill a lot. And very importantly, if you have something which is like a limit, show and guide them where less expensive treatment is available. I learned this from Dr. Jethwa. So you have to be with the patient. You tell him, yes, so and so government hospitals, you can get it at a lower rate, and so and so. And very important thing is, if you are very careful with the administration, charge less than estimate. So you give a very big estimate, and when you charge less, all patients will be very happy. So that is another good method of promoting yourself as far as your reasonable earning is concerned. Everybody has said very well that your appearance reflects quality of your surgery. Will my screw will be longer or shorter? Will my screw will be apt or not? My length of the plate will be good or not? All depends on my fitting of the dress, my language, my attitude, my vascularity, my facial expression, and my lifestyle. So from there is an indirect communication and dialogue, or sort of a impression by the patient, that will he be able to do a nice and precise surgery on me. Very important point is that do not spend money on advertisement or big boards, because free opportunity is there when patient is in the waiting room. It's a very important time when they are waiting for you. So fully utilize time of all visitors in the waiting room, the best, most effective, costless opportunity to promote yourself. So have a clear display of facilities, expertise, and affiliations. And that is the time where they have nothing to do but a time for you to promote whatever you have in your facility or institutions. Another very important thing is that do not think that what you are talking about is perceived. There is a collateral impressions. The relatives and visitors, they know everything. They already have decided that if I get a femur fracture, whether I'm going to come here again or not, although they have come as a relative of the patients. So there is a collateral impression of whatever you do, whatever your staff do. So person who is paying the bill is again a very important. He is usually not the patient, but you have to be very careful that he's an elderly person who is paying the bill, or the contractor, or the owner. So you need to see that they are comfortable while paying the bill. Of course, the patients get collateral impression. Referring person, he keeps a note in the society. I referred and what happened to that. So be careful to give all feedbacks to that. Very importantly, all your hospital staff, they know how do you deal with that. They also create a good impression in the society. So that is a collateral impression we have to be very careful as a whole to the society. So beware to signify self, create better impressions, and see that it is perceived as a collateral. Most and potential source of future patient is your collateral impressions. So that will bring more and more patients. Another point for that is your team, your staff should be always free, fresh, and smiling. Once you have prescribed something which is not available in the pharmacy, it's a big panic. So do not do that, because it is a collateral impression that something you do not know about your own chemist and you are going to prescribe. Have to have a single window administration that gives a best comfort. Cultured and comfortable ambience. It has to be cultured. It should be with the regional area, and it should look like that it is our hospital, our culture. Strictly not bad smelling. Take immediate action if the waiting room or OPD is bad smelling. That gives a big, very bad sort of a negative impressions. And always use a full illumination in the OPD area. In the OPD area, do not try to cut off lights. You can do everywhere else, but in OPD it should be fully illuminated. This signifies your taste and concerns indirectly. That is how they get an impression, and you can promote your that I am always up to date and I will take care of other than only the treatment. Sometimes, as speaker said, that you have to do some natak. You have to really help them. So you have to respect and help old patients. Come out of the OPD, greet him, help him to come inside the OPD to the disabled patients, and also to the children. Play with the children, because they want that the doctor is in part of their family. So this signifies your humanity. So all the other people who are sitting in the waiting room, they will have a good impression that this doctor is genuinely for the mankind. When patient is critical, team has to be serious. Please avoid. If the patient, we are very bad in bad conditions and the staff is taking selfie, that is at all not allowed. So you have to have a big sort of a eye on this type of incidences. Be very careful for that. Then damage control. Sometimes we do not know. So take all safety measures. Everything in your OPD area, including the electricity or the lift or whatever, you have to take all safety measures. Buy all accessories for new equipment. Never say that I have bought it, but this type of facilities I have not bought. So whenever you want to buy anything new, maybe CT scan, MRI, or whatever the gadgets or whatever, buy with all accessories. Keep all gadgets up to date. It's not like this for last 2 days the cold water is not available. Everything, whatever you want to give a facility to the patient, it has to be up to date. And employ expert technicians, which is very important. You might have to pay a little more, but this signifies your administration, because the person who is taking X-ray, if he's good, it will make a big collateral impression to the patient. Another thing for the damage control is you need to have a separate OPT bi-weekly time for chronic complicated cases, because they are going to give a bad impression to the other patients. So when you know that this patient, you did not declare it, but you know that I will be calling on Thursday evening, so that there are other patients who can be separated with that. And I have been taught by my great guru, Dr. Dinubi Patel, that 60% will pay much less than expected. So take it granted. Do not indulge with less payment whenever at the end. So do not go with a quarrel with that. And we have to be very careful with the misconduct and threat by the staff. In that, do not shout. Do not show your anger. You have to show your calmness. And that signifies your quality. And that is how you can be promoted. But everything happens, but he is always in a sense, and he is always in a balanced way. So it will not deteriorate my treatment. Technology, very important. Acquire and adapt today's technologies, because this is the only way you can signify your pace with that of current world. If you are not with the technology, people and the second generation, their children, they will immediately point out that you are out of date. So you need to have technology. And for the society, this is very important. Lead a series of physician community partnership town hall meeting. That is very important. Otherwise, they do not know how good you are. So all these questions, common questions can be, so have some sort of such meetings in your area or in your society or city. Then very important thing is that whenever you are doing something unusual or something very important, invite your colleagues and students from the medical college. That will make and promote your skills and your whole way of treating the patient or operating methods or whatever. Participate in worthy conferences. Your selection of conference also makes your impression, and participate, do not just be a delegate. On over the social media, we know it is the most acceptable conveying of your expertise. So go on posing your patients, your queries, your interactions, because whatever you are going to give response on this social media is well judged by everybody, and that also is slowly creating that which way you are worthy of promoting of your expertise. So that is very important. And the last slide is that you need to avoid negative qualities. As in the 18th Adhyay of Bhagavad Gita on 28th slok, there are some of the negative qualities of human which you have to avoid. For example, discordant. You should not be harsh anyway for anything. You have to have a sweet language. You should not be stubborn on anything. You have not to cheat. You should have not any malicious ambitions. You should not look indolent, which is very important. Lethargy. You say, okay, I'm just coming. Okay, I'm doing this. Or you do not, patients should feel like you are fast enough to take care whenever there is any emergency or whatever. Do not remain hopeless, hopeless, or do not show that you are hopeless. So this pareful is again a quality we should avoid, that whatever is possible in the given situation, in the given stage of the patient's disease, whatever is possible, show that hope and explain about that. And lastly, procrastinating is very good. Do not delay. Do not unless say that okay, we can do after 1 month or after 2 months. That also is a negative qualities. And at the end, please avoid all personal comments, but nobody likes personal comments. So I thank you very much for this opportunity for the organizer. I hope you like all these points which I have given, and I'm open for any questions or comment. Thank you.